Ma'am?
Hi, my name is Kelsey and I'm going to be your student nurse today. Today we will be doing a head to toe assessment. And so to start, could you please give me your name, date of birth?
Sherry Maheffer, 52268.
Okay, I'm gonna double check that information on your bracelet. Okay, that looks good. And so to start, we'll be doing a neurological exam. And so I'm going to give you 3 words that I'll ask you to recall at the end of our head to toe assessment today. And those 3 words will be pillow, plant, and dog. Pillow, plant, dog. So could you please tell me where you are?
I am at Old Ocean House Road.
Okay, and what day of the week is it?
It is Thursday.
Okay, and what's the number date?
Oh, it is August 5th.
Yes. So our patient is alert and oriented ×3, and her speech has been clear and concise. So next I will be doing a skull and scalp assessment. So starting with my scalp assessment, I'm looking for any lesions or any critters, and I see none. Next I'll be palpating your skull, looking to make sure that both sides are equal, looking for any abnormalities like lesions or masses, and all looks good. So next we will be doing the eyes, and so I will be assessing for Perla, and so I will be making sure that the patient's eyes are equally round, and so looking at my patient's eyes, they look equally round, and then testing for their reaction to light. I'll be shining my pen light into the right eye and then the left eye, looking for equal consensual constriction of the pupils. Okay. Next I'll be testing for the eye's fixation ability. So if you could just look at my fingers and watch them as they come in towards your nose and then away. Eyes are fixating, and then lastly I'll test the patient's peripheral vision. So let me know when my fingers come into your range of view.
Yep.
Okay. Then I will be looking at the patient's ears. So a lot of times when people forget to put sunscreen on their ears, so I'll be looking for any lesions, which I do not see any lesions on either side. And then I'll be testing for mobility, so pulling them down and out. Okay, good mobility. And then lastly, I'll be pushing on the patient's tragus, and you just let me know if you feel any pain or tenderness with this. There it is.
None.
None, okay. Then we will be looking at the patient's nose. So if you could look up towards the ceiling for me, and I'll be shining my pen light in to look for any polyps. I see no polyps. Septum's midline with no deviation. And then I will be looking or palpating the patient's sinuses. So starting with their maxillary sinuses, and let me know if you feel any tenderness. Okay, and frontal sinuses, and then ethmoid sinuses. None, okay. Then I'll be looking at the patient's mouth, and so if you could say ah for me, and open up wide. Okay. And so the patient's tonsils don't appear red, they look normal. The uvula is rising at midline, and the posterior palate looks equal, and yeah. Okay. Then, oh, and also if you could raise your tongue for me. Okay, and teeth look good as well. Then we will be looking at the patient's neck, so I will be looking at all of the major lymph node areas. So when I palpate your lymph nodes, let me know if you feel any tenderness. So I'll be doing preauricular or preauricle, postauricle, occipital, and then occipital, submental, submandibular, this area, what is that called? The main one, tonsils, and then the preauricular chain, postauricular chain, and supraclavicular. Any tenderness with any of those? No. Okay, and then I'll be doing a trachea or tracheal assessment. So palpating along the trachea, and there are no deviations of the trachea. It's at midline. And then I will be looking at the patient's thyroid. So if you could swallow for me. Okay, and so the thyroid has normal mobility, and when I press on your thyroid, let me know if you feel any sort of pain. No. Okay, good. Next, I'm going to be listening to your heart, and so I'll be listening to the 5 major 8 Taman sites, so aortic, pulmonic, Erb's point, tricuspid, and mitral. And S1 and S2 were auscultated. Next, I'll be listening to your lungs. So I'll be listening at 6 points on the anterior side and 6 points on the posterior side. And every time I move my stethoscope, if you could just take a breath in and out for me. Okay. Okay, so lung sounds are clear, no gallops, rubs, or murmurs. And now that we've done the lungs, I'm going to be looking at your fine motor coordination. And so to test this, I'm going to hold my hand out in front of you, and if you could just touch your nose to my fingertips with your hands. So holding my hand out here, so use your fingers and then touch your nose, and then touch my fingers. Touch your nose, touch my fingers, nose, fingers. Okay, so the patient's fine motor coordination is intact, and then I will be looking at gross motor coordination and skill. So starting with the upper extremities, if you could squeeze my hands, or squeeze my fingers, okay, good. And then if you could, so next I'm going to apply pressure to the top of the patient's foot, so I'm testing their foot strength, and then if you could try to bring your toes up towards the sky, or like pick up your foot, well, so like, go like that.
Oh, okay.
Yeah. Okay, this side. Okay, and then lift up your foot just like that again, and then press down on the gas pedal, okay? Opposite. Good job. Okay, and next I'll be assessing the patient's pedal pulses. Okay, and pedal pulses are 2+ and equal. And I forgot to check your radial pulses up here as well, so if you just hold your hands out for me. Okay, radial pulses are 2+ and equal. Also checking the patient's skin turgor. Skin turgor looks good, and capillary refill in the upper extremities. That looks good as well. Okay, and then I need to check your posterior tibialis pulses. Those are 2+ and equal. Then to test your lower extremity strength, I'm going to apply pressure to your leg. If you could kick out for me. Okay. This side. Good. And bring your heel towards the couch. Okay. Okay. Next, I will be, went a little bit out of order, that's okay. Then, we did that. Turger, I haven't checked the capillary refill of your toes. Okay. Less than 3 seconds. Less than 3 seconds. Okay, now I need to test your upper extremity strength. So, if you could hold your hands out like this, and I'm going to apply pressure to the outside, and if you can resist. Okay, and then inside with the shin. Okay, good job. Make sure I'm not missing anything. Ew. Okay. Then we have to do, it's called the cotton ball sensation test. I'm going to be doing it with the back side of my pen. And I'm going to do it first on your hand, so just close your eyes and tell me where I'm touching lightly with my pen. Okay.
Top. Middle finger. Is that index finger? Is that what they call it?
Yeah. Okay, and then same thing, but on your feet.
Top of foot. Big toe. Under my ankle.
Yes. Nice job. Okay. And I believe. Okay, and I also don't see any edema or swelling in your ankles or feet. Okay, so next we will be doing our spine test. So if you could stand up for me. Okay, and face that back wall. And I'm just going to palpate along the sides of the patient's spine and let me know if you feel any tenderness.
No, that's
No.
good.
Okay, and then if you could bend over and touch your toes for me.
Oh, jeez. Not very
Or
flexible.
as far as you can go, yeah. Okay, and stand on up. Okay, so there's no tenderness. The spine feels straight with no deviations vertically or laterally. Then I will be looking at the patient's gait. So if you want to come back and stand next to me, and then just walk straight ahead to the coffee table and back. Okay, the patient's gait looks fluid and even. And then next I'll be doing the Romberg test with my patient, so assessing her balance. And so if you could stand with your feet together and then close your eyes, and we will be doing this. I'll be timing the patient for 30 seconds. Okay, 10 more seconds. Okay, so you're good to open your eyes. And so there was little swaying, so our patient's negative for the Romberg test. And next I'm going to have you laying down for me, but with your back elevated at about 45 degrees. So if you want to put your back up against this pillow, laying down. Okay. And here we'll be looking for any jugular vein distension, and I will be auscultating for bruits. Okay, so looking for any, yes, you can just look straight ahead, and looking for any jugular vein distension on either side. This side looks good, and this side looks good as well. Then I will be auscultating for bruits over the carotid artery. I did not hear any bruise. Lastly, we'll be doing your abdominal assessment. And so just looking, doing an initial inspection of the abdomen, it looks soft and non-distended. Next, I will be auscultating the 4 quadrants, starting in the right lower quadrant and working my way around. Okay, and all quadrants had vowel sounds that were normoactive. And then I will be palpating, doing first a light palpation and then moving to a deep palpation of all 4 quadrants. Let me know if you feel any tenderness. Nope. Nope. Okay, and then the deep palpation. Nope. Okay. And so can you tell me a little bit about your diet?
I eat a lectin-free diet, which is like no seeds, like no carbs. Well, little carbs like almond flour and stuff like that. No
Okay.
sugar, low sugar, all natural type of.
Okay, sounds like you eat very, very healthy.
I
Do you
do.
feel like that diet's been working for you? No, not a
Mhm.
ton of like abdominal cramping or pain with the
No.
diet.
It helps with all kinds of inflammation, so it works well for me.
Good, good. Okay, and do you feel like your bowel movements are pretty regular when you follow this diet?
Much better since I followed this diet.
Good, okay. And do you feel like you have like abnormal amounts of diarrhea or hard stools?
Nope, it's gotten better. I used to have hard stools, but now I feel like it's much regular.
And what about your like urination patterns? Do you feel like those are pretty frequent?
Yeah.
Okay.
Good. Yep.
Okay. And any like cloudy or super dark urine?
No.
Very hydrated.
Mm-hmm.
Good. Okay. And so that pretty much completes our head to toe assessment. Could you just tell me those 3 words that I told you at the beginning?
They were dog, pillow, and plant.
Yes. All right. So your short-term memory is intact. Head to toe is looking good.
And I remember you saying my abdominals were soft.
Yes, soft and non-distended. That's what we're looking for.